Hi, my name is Yap Eng Seng and I'm from the School of Biosciences from Taylor's University, Malaysia. My topic today is about Ebola. This is my school, Taylor's University, Malaysia. Before I start, I would like to briefly discuss about what is Ebola on my point of view. To me, Ebola is one of the severe illness that cause huge damage and huge impact to the humanity and to the earth. What is Ebola? I will now have a brief introduction on what is Ebola. Ebola virus disease is formerly known as the Ebola hemorrhagic fever. Is a severe illness that causes human fatality. The first ever recorded outbreaks of EBD occurred in Sudan, caused by the Ebola Sudan between June and November 1974. On March 23, 2014, WHO was notified of an outbreak of Ebola virus disease in Guinea, Africa. The overall prognosis of those who are infected with EBD is relatively poor, with high mortality rate of 90% of EBD cases. Ebola virus is regarded as prototype pathogen of viral hemorrhagic fever, and with the absence of proper treatment, it was declared the biothreat pathogen category A. This picture shows how severe the cases is affected by the Ebola. While these two pictures show the Ebola virus under the different type of microscope. Next, we will go to the transmission. Ebola can be transmitted through a close contact with a person who is infected with or has died from the Ebola. Touching the blood or bodily fluids such as breast milk, urine, saliva, sweat, vomit, and much more of a person who is infected with Ebola will also cause the Ebola transmitted. Next, the uses of syringes and needles contaminated by the Ebola patients, and also handling the infected animals by touching their blood or other body fluids or their meat will also causes the Ebola to be transmitted. On the other hand, Ebola cannot be transmitted through air, water, food, mosquitoes and other insects, and also the contact with survivors of Ebola, although the virus has shown up in semen for up to 3 months after recovery. There are few symptoms we show by after affecting by the Ebola virus. It will normally show up to 2 to 21 days. The symptoms such as high fever, headache, muscle aches, sore throat, stomach pain will appear in the early stage, and at the final stage, it will also causes internal bleeding or even cough up blood if it is very serious. The typical pathway from the human being go through by the Ebola virus. At the first symptom, day 7 and 9, the headache, fatigue, fever, and muscle soreness will be applied to the patients, while at day 10, a sudden high fever, vomiting blood, or passive behavior will also have it on the patients, while in day 11, brain damage or also bleeding from the nose, mouth, eyes, and much more. And the final stages, which is at the day 12, the patient will undergo a loss of consciousness and also massive internal bleeding or even causing death. This graph shows how serious cases that appear in the West Africa. Towards the Ebola death in West Africa, the green color represents Guinea, while the yellow color represents Liberia, and the violet color represents Sierra Leone. This is how serious
about
it
the prevention
towards
and the
the
treatment
graph
for
of
the Ebola
April
virus.
2014
Basically, there are no
and towards
vaccines
October
for the Ebola virus
2014, and only can be avoided from traveling to the infected area. There are some prevention can be made through the mask wearing, gloves and goggles when in contact with the infected people, such as the two people that wearing the gloves and the shirts in the picture. In a nutshell, the Ebola virus has caused a fatal disruption to the humanity and animals. In order to prevent this strategy to expand, all should take initiative to have body check-up as soon as those symptoms appear in order to reduce the chances of the virus spreading towards. Here is all my presentation towards the audience.